Hello again. I'm Dr. Meltem Zeytinoglu. I'm an assistant professor of medicine and the Endocrine Adult Fellowship Program Director at the University of Chicago Medicine. And I am excited to tell you a little bit about my own interests today and hope that along the way some of you may share some of these interests that we can discuss further during the interview process. I did my training at Indiana medical school at Indiana University, and there I got a combined degree, MD and MBA degree, because of my interest in health policy and my thought that understanding some of the sort of health policy side, the financial side, it could help me in health policy of chronic diseases. I then went on to complete my training, my residency training at the University of Chicago North Shore program, as well as at Johns Hopkins University, where I did preventive medicine training. And then I completed my fellowship at the University of Chicago and have been here as faculty now in my 6th year. I had a strong interest in endocrine education, and so I became, within a few years, I helped create some endocrine education opportunities for all levels, med students, residents, and fellows, which we gladly encourage our current fellows and future prospective fellows to do. And so I became the Associate Fellowship Program Director as a result of those. And this led me to the wonderful opportunity I have right now to serve as a training program director. I have a clinical and research interest in geriatric endocrinology, where the burden of disease, the metabolic disorders such as diabetes, osteoporosis, and obesity is the greatest. Despite this, because of the heterogeneity of health conditions in older adults, there is a very limited, relative to in younger adults, body of research. And so this is an area of interest to me. Most of my clinical practice at the University of Chicago is almost exclusively osteoporosis and diabetes in older adults. And so within osteoporosis, I have an interest of bone fragility and diabetes, and secondary osteoporosis in patients with other chronic diseases, as well as a research interest in clinical osteoporosis clinical trials. On the education standpoint, I am privileged to serve on the American Diabetes Association Early Career Advisory Group. And so we do a lot of work for fellows, including the pre-meeting for the American Diabetes Association scientific sessions. So I really am privileged to work at the University of Chicago, where I collaborate often with my colleagues in geriatrics and GI, rheumatology, on patients with complicated osteoporosis and diabetes, and I look forward to training some of you in that area as well. Thank you.